Hi, this is Dana Rockey, and many of you know that have watched my videos or been to our office or seen me speak. You know that here we do what we call wellness-based dentistry or integrative dental medicine. We believe in the oral systemic connection here. We believe that oral issues can have a dramatic effect on systemic health, and systemic health can certainly show up in conditions in the oral cavity. From the very beginning, talked about the blending of medicine and dentistry, talked about the systemic condition and the oral condition, how that all works together, and how even modern dentistry should really begin to be having these conversations and looking beyond filling a tooth or looking beyond putting a crown on a tooth, but really how can we improve the health of the patient. That was our idea, that was in our mission statement right from the very beginning. Including in that is American Academy for Oral and Systemic Health. I belong to that organization, and that organization in it has physicians, dentists, registered nurses, chiropractic, all sorts of healthcare providers, and we all think similarly. We all think that everything is integrated, and we really shouldn't, as practitioners, be sitting in our own silos treating only our narrow approach to what we have to treat, but we should be looking at a more collaborative effect. That's in the mission statement for AAOSH, which is a wonderful organization. This is part of a letter that AAOSH developed that kind of expresses its mission statement, and I'd like to read one particular paragraph of it. And it talks about knowing the impact of inflammation, and I've spoken on that a great deal, as inflammation being the source for chronic disease. Both physicians and dentists should be equally interested in reducing inflammation from all sources and should not pull back from building cooperative, interdisciplinary networks which co-manage their mutual patients' health, as was established in the consensus report jointly published by the American Academy of Periodontology, of course that would be gum work, and the American Journal of Cardiology. At a minimum, as the American Heart Association statement documents, good oral health lowers inflammatory burden and endothelial dysfunction. That's vascular disease, which is paramount in things like heart attack, stroke, all of that. Therefore, it should be included in any treatment plan which supports an overall healthy lifestyle, as well as in any professional treatment plan to this end. So that's really our goal here, is do what we can under the guise of our dental license, knowing full well that we're probably contributing to the overall health of the patient. So I have two messages here. One to patients or prospective patients. If you have health concerns that have been coming from a medical practitioner relative to something that might be related to periodontal disease or headaches or temporomandibular joint issues, any sleep disorder issues, lifestyle and nutrition issues, maybe facing surgery, pre-surgical evaluation, or other sources of non-specific systemic inflammation, these are the conversations that you should be having. And these are the kind of issues that we think should be raised and what we take pride in working with here in our dental office. And to other healthcare providers, to the betterment of the health of your patients, consider that a person like myself works with these issues, and sometimes solving a problem outside the medical arena, possibly in the dental arena or in the lifestyle arena, can dramatically affect, for the better, the health of the patient in your office. So that's why I have always encouraged working with physicians, building that collaborative effect between all of us in the healthcare field. Thank you for watching, and look forward to working with you all.